TMZ is reporting Prince was treated for an overdose of opiates last week after his plane made an emergency landing in Illinois.
Fox 5's medical expert, Dr. Chaffoo, joins us now with more. Good to talk to you, doctor. Thank you for being here.
You too.
All right, so let's talk about what kind of drugs we're talking about here with possible opiates.
So opiates could be essentially any kind of prescription medication that's a narcotic. Could be oxycodone, Percocet, Vicodin. Would be, any type of prescription pain medication, something that requires a physician to write, or it could be something like heroin, obviously a more illicit drug.
Wow. Okay, so TMZ reported the doctors in Illinois, they use this save shot. We've been hearing a lot the last 12, 14 hours about the save shot on Prince. What is that, and what is it used for again?
Well, it's used for, Raoul, if you have a patient that comes in typically in an extreme situation that you have a high suspicion has an opiate overdose, and there's an opiate triad. You typically would have pinpoint pupils, you would have a loss of consciousness and respiratory depression. Very high index of suspicion. At that point, you can give this medication called the safe shot or naloxone or Narcan, and it can be given intranasally. So if someone comes in an extremist situation, they don't really have good access, they can't get a good vein, you can put it in intranasally, and it's essentially like giving it intravenously because there are numerous blood vessels in the nasal cavities, and it's an immediate reaction. It will completely reverse the effects of an opiate, but importantly, if you don't have opiates in your system, it's not particularly harmful. So it's a very safe medication, of course, given under the direction of an emergency physician.
Yeah, so it has to be, they only have this in the hospital?
Absolutely.
It's not like they go around with having these in stock or anything, right?
Right, it's not like an EpiPen. Exactly.
Right, okay.
It's interesting because we know he was hospitalized last week. Representative said he was dealing with the flu. There are reports of some other situations, and there are reports coming out that possibly he was released from the hospital too early. What kind of downtime would somebody have if they were dealing with an overdose and a possible safe shot?
So a lot of that really depends upon how severe the overdose was and how long they've been on an addictive process. And of course, usually what happens is if you get something like Narcan or the safe shot, you need to get hospitalized because you need to watch your cardiac, your respiratory system. You can have a rebound, and certainly you want to make sure that that patient is stable. This is an addicted patient. They need to be monitored. They need to go to a rehab facility. So it's not just, oh, I'm going to give you a shot and send you out the door.
Right. As a doctor, what do you do in a hospital? Because the reports say that they wanted to keep him for at least 24 hours, obviously for observation, and his team basically said, no, give him a shot, and then they took him away.
Yeah, it's unfortunate. I mean, this is what's called checking out of a hospital, AMA, or against medical advice, and all of us as physicians have seen that. It's unfortunate because, the doctor is most interested in what's best for the patient. In this case, in any case, you have a reason that you want to keep a patient in the hospital, monitoring their respiratory, their cardiac status. They can have, cardiac standstill, and then obviously get them involved in some sort of a rehabilitation program. So it's something that really is not in your best interest, and you have to sign paperwork and say, look, I'm not taking the doctor's advice. I realize I'm putting my health and potentially my life at risk by leaving the hospital.
Lastly, his autopsy is expected for today. Well, talk to us about what sorts of things they're going to be looking at to try to determine exactly how he died.
Sure. So the big thing would be toxicology tests. They'll look at they'll look at the urine, they'll look at the blood. There may be tissue samples that they'll look at. The autopsy will look at organs to see if there are any long-term effects of drug addiction and acutely, what type of drug or drugs are involved. It's not uncommon for people that have been addicted to have kind of a multiple drugs in their system that obviously all of which can have a combined deleterious effect. So it's not usually just one drug, it's a combination, and it's that combination sometimes it's extremely dangerous. It can potentiate cardiac and respiratory symptoms. So some of these toxicology tests can be found out rather rapidly, and some of them take a few days, specialized laboratory to see the results.
Such a tragedy, Dr. Chaffoo. It seems like we're having the same conversation when Michael Jackson passed. It was a very similar line of questioning about another one of our big stars. Dr. Chaffoo, we thank you for taking the time this morning.
Sure.